Semaglutide comes in a few different forms, and knowing how to safely access each one is an important part of using it correctly. Before we go any further, this video is about packaging identification and safe access only. We're not covering dosing or injection training here. For that, always follow the official instructions for use and work directly with your doctor or pharmacist. They can walk you through the full process hands-on. So let's break down what you might have been prescribed. If you're using Ozempic or Wegovy, you have a pre-filled injection pen. There's no bottle to open. You pull the pen cap straight off, don't twist it, and the medication is already sealed inside. Ozempic is a multi-dose pen, while Wegovy is a single-dose pen with an integrated needle. For the specific steps on how to use your pen, follow the instructions for use that came with your prescription, or ask your pharmacist to show you. If you've been prescribed Rybelsus, that's an oral tablet. It typically comes in blister cards here in the US, no vial involved at all. Now, compounded semaglutide is a different situation. It's not FDA approved, but it may be prescribed through a state-licensed pharmacy when FDA-approved options aren't appropriate for a patient. Compounded semaglutide typically comes in a small glass vial with a rubber stopper held in place by an aluminum crimp and a plastic flip-off cap on top. Here's the key thing. You only remove that plastic flip-off cap. That's it. The rubber stopper stays in place the entire time. You never pull it out or remove the aluminum crimp. Before you handle any vial, wash your hands thoroughly with soap and water for at least 20 seconds and dry them completely. Then, before each use, clean the rubber stopper with an alcohol wipe and let it air dry for at least 10 seconds. That drying time is important. It's part of maintaining sterility. Any access to the vial contents and dose preparation should be done only as instructed by your prescriber or pharmacist. Please don't rely on online videos for that part. Before opening anything, take a moment to check a few things. Make sure the tamper-evident seal is fully intact. Check the expiration date on the label. And look at the solution. Semaglutide should be clear and colorless. If it looks cloudy, has particles, or appears discolored in any way, don't use it. Contact your pharmacy right away. On storage, Ozempic pens can be kept refrigerated or at room temperature for up to 56 days after first use. Keep the pen cap on and store it in the original carton to protect it from light, and never store a pen with a needle attached. Compounded vials generally require continuous refrigeration. Your pharmacist will give you the specific guidance for your product, so follow their instructions closely. A few things to avoid across the board: never freeze semaglutide, never reuse needles, and never use a product if the seal looks broken or the packaging seems tampered with. If anything looks off, the packaging, the solution, or you're just not sure you're handling it correctly, reach out to your pharmacist before using it. These are questions they expect and are fully equipped to answer. Quick recap: semaglutide comes as pre-filled pens, oral tablets, or compounded vials, and each is handled differently. For compounded vials, remove only the plastic flip-off cap, wash your hands first, clean the stopper before each use, and follow your prescriber or pharmacist's exact instructions for everything else. Nothing in this video is a substitute for personal medical advice. Talk to your doctor or pharmacist about what's right for you and your specific product. If this was helpful, drop a question in the comments, and we'd love to hear what you want us to cover next. And if you haven't already, like this video and subscribe so you don't miss what's coming.